Popping your right ankle up onto your knee, and you're just sitting forward and letting your body slump. So usually this is taught you kick your back really straight. It's fine, it's good. We're doing something a little bit different here. So we're letting the back round, and all I'm doing here, I'm breathing in through the nose, and I'm breathing, letting my back inflate, and a sense of also inflating my pelvis. So we're using the breath. Then out through the mouth, in through the nose, inflate the back, inflate the pelvis. You may find your body just wants to drop down more as you breathe out. Then sit up straight, pull that knee towards opposite shoulder. So we're getting more space in the hip capsule and stretching the piriformis muscle, stretching all the glute muscles, and we're stretching open the muscles and the fascia in the back, and helping the kidneys to move too. So the kidneys, when we breathe, they move out and down about 1 to 3 centimeters. So in this motion, it's actually part of kidney breathing in Qigong. So it's helping the kidneys to move, which opens all the fascia in your back. And we come forward again, and I'll just show you this from the side. So I'm letting my back round here. So I'm not staying straight. You may feel you're trying to round, but the back's staying straight, that's fine. Just shows how much of an extension pattern your body's in. It'll feel like you just got really tight glutes, but it's actually an extension pattern in the spine. So we're letting that round out, then we're breathing in through the nose, as if I'm inflating my back and the pelvis, and I'll breathe out. Then I start rocking this knee here, the leg with the foot on the ground. I just rock the knee side to side, and then I'll open and close the SIJ, exactly that joint at the back of my pelvis, and stretch the muscle in the capsule a bit more. And what that looks like from the side is just that. So it's this knee making the motion. This one's quite passive. And we change sides, same thing again. And you'll find one side's tighter than the other. Often it's the left side. Just letting my back round out, getting a stretch in my glute, breathing in through the nose, inflating the back, inflating the pelvis. Not trying to force it, just letting the weight of my body do all the work and the breathing. And if this causes pain in your knee, you pull your foot up like that. That can help stabilize it, or you can keep the foot a little bit turned this way. So I'm trying to turn the foot up this way. It'll cause an internal rotation in the knee that often helps a lot of knee issues if you feel pain here. If that doesn't help, don't do this position, get into your knees better. Then from here, sit up straight, bring that knee to the shoulder. I'll stretch the glute differently. And we just breathe into the pelvis again. It sounds like a silly idea to breathe into your pelvis, but your pelvis does actually expand with every single breath we do. And from here, we do the same thing. So we're crunching forward again, or slumping forward is the word. About 5 breaths is good. And we're moving the knee, so this leg, moving the knee, rocking like you're rocking your baby. Okay, so that series will expand open the hip joints and allow more play in the hip joints. It'll take pressure out of your back, pressure out of your knees. It'll help the movement of the feet too. And repeat that sequence again too. So we're coming back up to here and repeating that series. Back to here, bend over forward again, do the 5 breaths. Then we're just rocking this side to side and we change legs.